It's Alan here. I'm just introducing myself, and I'll let you know what's happening about today's session. So I'll give a bit of an introduction and a talk about what's happening about trying to get a job in Australia, and also then at about 2 o'clock, I've got a doctor coming in he's one of our ex-students that's passed the exams, but he's running his own business now, a locum service. So he employs about 200 doctors in Australia, in all the different states in Australia. So he'll be coming in to talk about 2 o'clock. And then I've got another doctor that's coming in at about pretty close to 3 o'clock. And he's one of our doctors that did our course a number of years ago. And now he's a consultant, emergency medicine consultant, who's working part-time and doing his and second fellowship, so in critical care. So he's going to talk to you as well. So I think both those doctors will be able to cover some of the questions that you might have in relation to getting a job in Australia. Okay, so I'm Alan, and I've been doing these courses for a long time now, more than 40 years. I've been running courses for the overseas doctors, and both for the MCQ exam and the clinical exam as well. Plus, I also teach with local medical students. I teach mainly 5th and 6th year medical students across a number of the clinical sites at the Austin, the Royal Melbourne, and the St Vincent's Hospital. So just to give you information about me, my training is psychology, not medicine, but I've been doing this work with overseas doctors for a long time. So the main thing is that to tell you about, there are a number of different pathways that you can decide whether you're going to adopt. And the main one for the overseas doctors is the standard pathway, which is the pathway where you'll need to pass the multiple choice examination, the Australian Medical Council multiple choice examination, and the clinical examination. And to get a job now, a number of people are getting jobs after passing the multiple choice examination and passing their English. And when I say a number of many hundreds of doctors are getting jobs with just MCQ and clinical, not clinical, with MCQ and English exam. So, but it's not that easy either. I mean, many people have passed MCQ and got their English, and then they're applying for jobs and they're not getting jobs. And then there are other ones that have been able to pick up jobs easily. But we'll talk about that as we go along in the seminar. Also, then there's the specialist pathway. The specialist pathway is where you really need to be a specialist from your country in whichever specialization it is, whether it's surgery or physician or pediatrics or obstetrician, gynecologist. And I would say that you would probably need to have at least 5 years experience as a specialist in your country to have much hope of getting through this specialist pathway. So with my experience with the specialist pathway, it's expensive and it's difficult, but it can, I mean, I've got a number of doctors that have achieved this pathway, but there are, I would say, a lot more of the doctors that have found this pathway to be very difficult. And from my experience, I've found it better that a doctor gets a job into the hospital, even though they say they might be a specialist in a particular specialization. Get a job in a hospital, and when you get in the job in the hospital will often realize that you've got those skills in that specialization, and doors might open for you that otherwise won't open for you with going through that specialist pathway. Also, to give you an example of that, I had a doctor come in to see me, and he was a pediatrician, and he was at the he came here and he said to me, "Oh, I come in to see you," and I said, "Oh, how can I help you?" And he said, "Look, I've just come from the College of Pediatrics, which is here in Melbourne, and I've had my specialist assessment." And actually I said to him, "Look, I think I can probably tell you what's happened." And he said, "What's that?" So I told him, which is they'd said to him, "Okay, we understand that you're a pediatrician." He was from Iran, and we'll give you credit for part one of your specialization. And now what you need to do is to get yourself into an Australian specialization program, and then everything will be all right. So what they've told him is virtually an impossible dream, because to try and get yourself into a specialist pathway outside the system is nearly impossible, because already the specialist training program inside the hospital is very, very competitive. So if they're going to start putting people outside the system into the specialist training program, it's going to make their own program look not good. So it's just not going to happen. So I said to him, "Look, come along, why don't you try and do our MCQ program that we run, and then see if you can pass that," because he'd already passed English. He'd already passed his English, and he didn't need to pass that. So he came and joined our program. By the way, his wife and child were back in Iran. He came and joined our program, and he passed his MCQ. And then he applied for jobs, and he picked up a job at Box Hill Hospital as a pediatric resident. Remember, he was a pediatric oncologist. So this was a very low job for someone with that sort of skills, with those skills and that experience. But he picked up a job as a pediatric resident. Once he got into the hospital, then the people in the hospital realized that what special skills he had. So now he is now a pediatric oncologist at Box Hill Hospital. Doors open for him inside the system that otherwise wouldn't have opened up. And now he's working as a specialist, and he's gone on and passed his clinical exam. And now he's working as a pediatric oncologist at that hospital. So it was a lot better, a more successful program for him to go through that pathway. First of all, take a lower job, get into the system, and then look for people to recognize your skills once you're inside the system. And now his wife's here and his child's here, and he's very happy. Okay, and then there's another pathway. It's called the competent authority pathway. Usually this pathway, people need to have passed their PLAB in the UK or the USMLE, and then they need to have at least had 12 months experience in that specialization or that fellowship, whatever, and then they can apply to come in for a job directly. And then there's short-term pathways, which I don't know that much about those pathways, but the doctor that comes in, you could ask him about that when he comes in at 2 o'clock. And then there's the GP pathway, where usually a doctor, you would need to have had at least, probably I would think, about 5 years experience as a GP in your country of origin. And you need to have passed the MCQ exam, and you need to have passed English, and then you need to get a job offer, and that job offer will usually be in an area of district workforce shortage or an area of need. Once you've got that job offer, then you'll need to sit a pesky exam, and the pesky exam is all about supervision levels. So level one is supervision after each patient. Level 2, supervision at the end of the week. Level 3, supervision at the end of the month. Level 4, complete independence. So in all my time that I've been doing these courses, I've only ever had 2 doctors get level 4 during their pesky, and both of them had very extensive hospital experience before they did the pesky and started working as a GP anyway. And then, of course, you can fail. And I would recommend that any of you, that if you decide to go down that pathway, and that I would say that you need to clarify with the clinic that they're happy to accept you in level 1 supervision, because I've had many situations where people are being given a job offer, then they sit the pesky and they get level 1 supervision, then the clinic's not happy because it needs a lot of supervision, and then the job offer will be taken away. So if you do get a job offer, just make sure that the clinic is happy that you can, if you happen to get level 1 supervision, that they're happy with that. Because even if you get level 2 supervision when you do your pesky, when it goes to APRA for registration, APRA has got the capability to downgrade your level 2 supervision to level 1 supervision. So that's why I think it's a good idea to make sure that the clinic is happy with level 1 supervision. And then there's the last one is you can get a job once you've passed your MCQ and you've got your English. Then you can get a job in a hospital working as under supervision. There are certain hospitals that are qualified to do this. In Victoria, I know it's Monash Medical Centre and Mildura Base Hospital. But if any of you want to know about which hospitals are involved in this program, you need to go to the Australian Medical Council website, and the hospitals are listed there. With those, even though they say there are these positions, they're very difficult to get. And usually, for example, in Monash, I know that the last few people that I know that have been taken into this program, they have already been working here in Australia, and then they've taken them into this program as well. But there are many, many hospitals all around Australia that do this program. It used to be free when they first set up this program. Now they'll charge you about $10,000 to do that program, but you don't pay, because when you're doing that program, you are assessed by your peers, but you're working. So they have a special program that's set out for you to do, and usually it can take up to 12 months. Then at the end of that month, that 12 months, your peers are asked to give a report on you, and if the report is okay, then you are given the registration and you don't need to do the clinical exam. Okay, they're the only pathways that I know. Now, when I mentioned to you about people getting jobs with just MCQ and their English exam. So there are many people like this, but it's very important that first thing I would say, if anyone's looking for a job after passing the MCQ and having their English, and then they're thinking, look, I'd try, like, because of whatever reason, maybe financial, or you just want to get back into the workforce as soon as possible. The first thing I would be thinking is that they need to sort out their CV. And the CV needs to be good, because it's your business card, your calling card. It needs to be good. So it needs not just any CV. So then what's important, of course, what you've done in your country of origin is important to be putting into your CV, but sort of things what you've done here, it's very important what you put into your CV. And that's where the bridging courses and things like that will be a benefit to you. So if you've done, for example, a multiple choice question bridging program, you need to be putting that into your CV. And it doesn't mean that you just put down one line in your CV. It means that you need to put some details, at least a paragraph, about what you've been doing with this bridging program and into your CV, so the hospitals or the clinics have an idea of what you've done here, that they know that you're familiar with the system here in Australia. I mean, I don't want this seminar to be an advertisement for IMGs, but, you know, many hospitals and many clinics know about our courses now. So if you've done your CV and you've put down that you've done one of our courses, and there's someone that's also competing for that position and they haven't done it, I'm telling you that the people that have done the course will be the people who get interviewed. So you need to also be putting down in your CV the CPD hours that you'll get for doing your bridging programs. So in the IMGs multiple choice, the one that's 6 weeks MCQ course, it's 252 CPD hours, RACGP CPD hours, and the 12 weeks after hours course is 172 CPD hours, RACG CPD hours. So even if you're one of the lucky ones who gets a job interview and then you get the job offer, when it goes to APRA to ask to sort out your registration, APRA can even ask you, what bridging course have you done? And they can ask you, have you got any CPD hours? Because often APRA will require you to have at least 100 CPD hours to give you the registration. So you'll get all of that with our courses that we do. So you've got to make sure that you're getting those things from other courses as well, if that's what you do.
Alan, is it okay if we can start answering some questions? There are a few people.
Of course, yes. Of course. Could you tell me the questions? Yeah.
Yes. Hi, everyone. This is the office manager here at Alan Roberts. I'll just assist Alan with the questions. So feel free to write down any questions or queries that you have in regards to any pathways or any job application or any other questions that you'd like us to answer today. So the first question that came was, it's just right in front of me here now, that should we go for a job first or start with the preparation of AMC clinical right away? Would that be after your MCQs? I think so.
So it's really, it's up to the individual, because, I mean, everyone's situation is different. It could be, you know, that they've got financial constraints, that they really can't afford to go on and do because the exam, not only the courses, but the examinations are expensive as well. So there might be many reasons, but, you know, my advice always is, people, I don't think you need to be focused in one particular area. Like take into account, just say I didn't have any financial issues. If I was in the situation of an overseas doctor, I would get my MCQ out of the way and I'd get my English out of the way. Then I know that I'm eligible for registration. Then if it was me, I would be trying to pass the clinical, whether I do a course, whether I'm preparing on my own, because you need to sit the clinical and get it out of the way anyway. And I would be trying to get a job at the same time as well. So one thing is not separate from the other. I would be trying, and whichever one works out the best, then, or the first, that's where I would go. Because even if you get a job, I told you, you'll start off with temporary registration, and then, but you'll have temporary registration for 4 years. In that 4 years, you must pass the clinical. And whether it's a GP or whether it's a hospital, I have a number of doctors that I know that think, oh, look, I'll pass the clinical, no problem at all. And they leave sitting the clinical exam up till about the 3rd year. By that stage, they've been working for 3 years and they're earning a good income. Often they've bought a house and they've got a mortgage, might have kids in private school or anything like that. They've got financial issues. And then they don't pass the exam. And then they're starting to get threatened by APRA that we're going to deregister you, which you don't need that sort of pressure when you're sitting the clinical exam. So my advice to any of you is, if you do have, like one of the lucky ones to get a job with just MCQ and English, make sure you think about English earlier, clinical exam earlier rather than later, to get it out of the way, because the later you leave it, the more pressure you'll be under, which will impact on how well whether you perform at the clinical exam as well.
And even Alan, the experience matters. If they have more experience, they should consider that. Right after internship, it's a bad idea, I guess, just to look for jobs. I think they should consider doing part two straight away.
I mean,
And
we have had people
yeah.
get jobs straight after internship.
Yeah, we do have.
But it is a hospital is more likely to employ you if you've got at least a couple of years minimum experience under your belt. Yeah.
Yes, yeah. So they should consider both. If you've got less experience, I guess they should start applying for clinical and start studying for clinical straight away. So there's someone that's Dr. Nepal here. I've passed AMC 1 with 2 years of experience. I've temporary residency soon. I want to secure a job immediately now while enrolling RIMGSS. What is the possibility of securing a job soon? So you have 2 years of experience, yes, plus internship or without internship?
I know she would have internship if she's been working. So my advice would be always first thing we need to do is look at your CV. And that CV needs to be an excellent CV, not just if your CV is not a really high class CV, you've got no hope of getting a job. So you need a good CV, and we have Kush who's just speaking to you. She helps the people do CVs, the people who do our courses, but you need referees. So those people that have done a course with IMGs, they can usually use me as a referee. So referees, of course, and again, I like to give examples. I can tell you that, I had a hospital ring me about one of the doctors, and then I always say this story when I'm doing my orientation with the students, and the doctor that rang me said, "Oh, we noticed your name in a number of CVs," and I said, "Oh, that's because we run bridging courses." He said, "Oh, I can see one doctor here from Peru. She's done your course, but all her referees are from Peru. We're not going to interview her." So I don't get that many doctors from Peru, so I knew who it was. And I said, "Oh, who's that?" And he said the name. And I said, "Look, she's quite good." They decided to interview her, and she got the job. And I shouldn't have done it because it cost someone else a job. But my point is they weren't going to interview her because all her referees are from Peru. So you need some referees from here. Ideally, I think when you're doing your CV, you need one referee from your country and 3 from here. And then, of course, people say to me, "How do I get referees? I haven't worked here." But you're the same as every other overseas doctor. You can get away with 2 referees from your country and then 2 from here, 2 from Australia, because they'll always contact 2 referees when they're doing a CV. And if you've got 2 referees from here, it makes it easier for them. But you must have a referee from your country of origin, because if you put all referees from Australia, you know what they're going to think. They're going to, if just say you're from India and all your referees are from Australia, they're going to think there must have been a problem with you in India. So you need to have one from your country of origin at least. So you can tell, you're virtually saying to them, if you want to contact them, there they are there, you contact them. Okay. But you definitely need referees from Australia. If you're looking for a job in Australia, and if I'm a referee for someone who's done my MCQ course, I don't have to say much. They might ring me up and they might say, "I'm ringing you about whatever the name is." And they'll say, "What were they like? Did they communicate well? Did they cause you any problems during your course? Did they get on well with the team members?" And questions like that. And then, yes, they did, blah, blah, blah. And then they'll say, "Thanks very much. We'll sort the medical stuff out in the interview." Often they just want to know what sort of person you are before, and you can be contacted either before the interview or after the interview, depending on the hospital or the clinic, what they want. Yes, Kush?
I'd like to add to this conversation. Sorry, Alan.
Yes, sure,
because,
Kush.
the candidate even asked me how soon would it be possible. We usually get these sorts of questions because everyone's quite desperate to start work. See, this all depends. It's all different with all of our candidates we've seen. It depends. Yes, one is on CV that Alan said. One is on your experience that you had another thing is how and what are the ways that you're adapting to work for it and what all you have in it. Because if you are a temporary resident and you've not done a course till now, you won't have any CPD activities in your resume for sure, and your interview skills as well, and how you are applying, not only just on Seek and Indeed, how smartly, where are you applying, what are the methods that you're, adapting. So all of those things really do matter a lot. So this answer is a bit tricky to say how soon. It's different journey for everyone, but it really depends a lot on you as well, how much and how you're applying. Then we have other questions. I've got a
And
few.
Kush, there not many people have got their Swarop has got her camera on. A couple of people have got cameras on. I would appreciate if they turn their cameras on too.
Yeah, okay.
I've got my camera on.
Yes, and I've got mine as well. So the next thing is English essential for Australian citizen as well, who studied in overseas university in English and has a master's degree from, what does it say? I can't see. I just have to scroll down. Have a master's degree from Australia.
The English, it's all up to APRA. So with that one, if you've got a master's degree from Australia, there is a possibility that you might get an exemption. But the only way you'll find out that is if you contact APRA. So then you would need to contact APRA and you need to speak to a case manager and ask them whether you would get an exemption for your English or not. But usually I find that you need to have done at least your year 12 in Australia to get an exemption from English. If you've done your year 12, if you've grown up in Australia and done year 12, then you've gone back to India, for example, and done medicine and then come back, usually you can get an exemption. But they're usually pretty tough on these exemptions. But the only people that can give you that answer is APRA.
Sir, this is Shagun Kaur. I have 1 year of internship, 1.5 years of job experience, which is still ongoing, 8 bands in ALS and AMC 1, currently working on my CV. Plus, I'm now starting to prepare for AMC clinical. Okay, so she was saying that this all experience she has and how soon, again, for the job, what she should do.
Any experience is good. 1.5 years is fine. Yeah.
After internship, which courses one can do besides preparing for MCQ exam to build a better CV? And there was another question that which year of MBBS should they start thinking about AMC, Alan? This is
So, okay, that's a good question. Like if you're overseas, and I think that, we have often, it's not unusual for us to have someone who's doing their final year medicine in their country of origin, and they'll enroll in one of our courses and we'll do the MCQ. So as soon as they've finished their degree, that they can eligible to sit the AMC examination as well. So it's very smart because a lot of the things we'll do, because this AMC MCQ exam is geared at final year medicine level. So the sort of things that we'll do in our preparation for people that are preparing for that exam will be at final year medicine level anyway. So it's sort of like a good thing to do for preparation for your medical exams in your country of origin, plus also good preparation for the AMC exam.
regarding the CPD hours, does it count if there are clinical gaps only, or how does a clinical gap can be accepted?
Yeah, this is something that's a question I often get asked, and there's nothing written down, but the anecdotal information that I can get is that about 100 CPD hours is the equivalent of 1 hour, 1 year gap. So if you've done whatever so many CPD hours you've done, if it's 200 CPD hours, that's equivalent of 2 years gap. But then a lot of the overseas doctors are caught up with gaps now. The gap is not, look, there were no exams for 2 years because of COVID. So you can take that out of the gap for a start. Then many pre-COVID, if you had a gap of maybe more than 3 to 4 years, often a hospital would tell you, or APRA would tell you, It's better to go back to your country of origin, work for 2 or 3 months, and then come back again, and that takes away the gap completely. And that's true. But since COVID, with the shortage of doctors, like one of our best tutors, she was teaching in the MCQ. She had 12-year gap, 12. And then she got a job offer and at a hospital in Tasmania, and the registration went through APRA. So people are worried about a 2 or 3 year gap. It's nothing. Okay? It's nothing.
So the question comes back again, Alan, that when should they prepare? When should they start preparing for AMC? There are 2-3 questions correlated to it. I'll bring them all in one queue.
Yeah, sure.
So one is saying that he has just completed internship, and when should he start the course? What's the best way? Which courses should they do? What's the
I
best?
think you would start the course as soon as possible, because
Yeah.
To sit this MCQ exam, the best to sit this MCQ exam is as soon as possible after graduation. But then to get that out of the way anyway. But then again, the best person to be in a situation to get a job is someone that's got some experience as well. But in relation to the question that you asked, when should they start preparing? They should start now, because you've just finished studying medicine, surgery, pediatrics, obs and gynae, psychiatry, medico-legal, all of this stuff, which all of the stuff you're going to be examined on in your MCQ examination.
Alan, we do get students who enroll with us while they're doing internship because they have a lot of time, and
Yes.
we've dealt with a lot of that. So any time is better because they start preparing for PLAB anyways in year 3rd as well. So why not for AMC since then too? So when you're in internship, whenever you get time, you'll be only able to sit AMC though when you'll submit all of your documents, when you'll get EPIC verification done, and when you'll get an AMC number. But preparation, you can start in the internship itself when you have a lot of time. We always tell them these are the books that they should start reading. So
If
yeah,
you can get an AMC number
yeah.
after part, you don't have to get that for you don't have to wait for your internship to be completed to get that. On getting your medical degree, you can get your AMC number.
Yeah. Does hospital experience have more bearing over locum work experience?
I think both of them are very important. If you've got your overseas experience, but if you've got local experience, that's terrific. But also, many of the overseas doctors, they might be working in other things while they're going through the exams, because the exams and courses, all of those things are expensive. So I know a number of people that are working as carers. I know a number of people have got other jobs that are related. Some might be a drug rep, or all sorts of things that might have some sort of association, or a nurse to medicine. All of that should be in your CV. So any work that you've done that's related to medicine, it should be in and it's in Australia, it should definitely be in your CV. It'll be a big bonus. And even I get some students that have done, when they're doing their own medical degree in their country of origin, they'll come out and they'll do electives in Australia and then go back to their country. So if you happen to have done an elective, that's a good thing to be putting into your CV as well.
So there's another question that someone has done a MPH, Master's in Public Health. Will it be considered as a gap?
No, it won't be, because it's related to medicine anyway. Masters of Public Health, I find that most of the people who are doing that, it's because of visa situation. But anyway, and it's good to put into your CV, but it's not that beneficial.
So there are a lot of questions, and is it okay if I answer a compiled answer for all of them, Alan?
Yeah, sure.
So one was, when should they start preparing? For preparation, you don't need any number. You don't need EPIC. You don't need AMC number. Just like PLAB, you can start with the AMC as well. You'll need to prepare for part 1, that is MCQs, and you'll need we usually say with the John Murtagh or a Blue Handbook, start with that. Then few of you asked that I have 1 year experience, 1.5 clinical year experience, what are our job options, or how soon can we get that? Now you need your CV in which you've got some continuous professional development activities done from Australia, some workshops. If you can register with RACGP or any courses that you've done, you should put that down as well. You need referees. You need to apply smartly. And a lot, if you've done some research, some publication, put that in as well. I always get this question that, does the research really matters? We don't have research. What do we do now? So it's not something that's really going to affect you. But yes, it's a good add-on because they know that you've done some research and all. Then when you have that sort of experience in your country, it's very important that you represent it really well, not just write that worked in this hospital. For example, there was a Chinese doctor. He worked in one of the biggest hospital in China. So we asked them to write it down on the line in front of it that he worked in one of the busiest hospital, which was which is one of the world's biggest hospital, considered that he's used to that sort of busy work. So these are the things. And then you need CPD hours, you need to mention about the courses, you need to mention about the detail of the courses, then you need referees as well. Then you've asked which course is good for you to enroll in for MCQ preparation. So you'll need AMC Part 1, that's Australian Medical Council Part 1 MCQ. So we have MCQ preparatory courses, 6 weeks and 12 weeks. You can go in any of those. 6 weeks is a 9 to 5, 12 weeks is a 7 to 9 p.m. So the 6 weeks has another free repeat, should be more than enough for you to prepare for Part 1. And I think that compiles a lot of questions here. So there was someone who was asking me about the skilled visa, Alan, regarding the skilled worker visa for an overseas doctor. Can we give any details about that?
They talking about the competent authority pathway?
No, this is visa, I guess, because there's a new visa now. They've again opened it, the skill visa. I think this is something with immigration. Our immigration lawyer can tell her more about it.
I think so.
Yeah. Then I've cleared my Part 1. Okay. How does the process of applying for an internship in Australia differ if we use USMLE results compared to AMC results?
Kush, can you take over for a little bit?
Yes, I can. I've been also asked about internship questions. How hard is it? Is it easy? And there was another question about how long does it take in securing a job in training program? So I'll give you a few examples. We had one of our doctors, she was MD OBGYN, and she had a lot of experience back in India with OBGYN, and she didn't want to go into HMO or other jobs. She really wanted to go OBGYN. So to be really positive about it, and with my 8 years of experience working here, I'd say that she did Part 1. She applied. She applied anywhere where she can. She got in Box Hill. Right after 6 to 7 months, they saw her caliber. So once you start working, they really know what sort of skills you bring to them, what sort of personality, what sort of work ethics you're bringing. Australia is full of opportunities. It's been really different after COVID. Pre-COVID, the situation was different. Post-COVID, it's really different. We are doing reference check almost every week for 3-4 doctors. 3-4 doctors are getting jobs just with MCQ Part 1. We had the Queensland campaign just recently, which finished. People are going for Gosford and other hospitals. So there are interviews happening. We are doing a reference check for them. So you should be applying in all of these campaigns which open. So that sort of information is what you get when you enter in a community here. So so she got into Box Hill with OBGYN, and then she was promoted to Reg within 6 months. So this is a sort of example that we give. With training, it's once you've done your general registration, once you've got into a job, into a hospital, you've finished your rotations within a year, or if you've done emergency 6 months, emergency and medicine, you will be eligible for your general registration. After general registration, they'll ask you, okay, Dr. Swaroop, in which specialization would you like to go? Would you like to do OBGYN? You'd like to do general practice? You'd like to go orthopedics? Which sort of specialization you'd like to go? Just giving an example. And then the doctor would say, okay, I'd like to go in pediatrics, or I want to, for example, my cousin chose general practice. She started as a HMO, then she went in gastro Monash, then she wanted to settle down a bit, so she's went into general practice, and the hospital found a clinic for her. So it's not hard to get into training within a year or two when you've done your general practice and you've shown your caliber, and there'll be senior positions arriving and the seniors might be asking you, so which training would you like to go ahead with? So that's what the pathway is to that. It's different for everyone again. So it really depends on you again, how you're applying, what sort of skills you've shown while you were working in the first year there. So from 2025, AMC2 will be face-to-face mostly. I'm planning to give AMC Part 2 in April. Will RMSAS prepare online or face-to-face exams and classes? Since COVID, pre-COVID as well, and post-COVID too, we've always been able to adapt. We are doing online and face-to-face since beginning, before the exam was even online till now. So both of the preparations will be done. Still as well, we prepare our candidates for both, online as well and face-to-face too, so that they can, and if they've been put in a situation, they can perform in both the ways. Does doing observership till we get a job help? Can you share something regarding observership in Australia? Okay, I'll answer this as well. I got done MBBS in 2022. Even since I've worked as a RMO doing many local duties till now, I'm also enrolled as a biochemistry tutor in college. I've graduated almost 2 years now, working as a RM in the evening. Throughout my MBBS, I've attempted numerous concerns, conferences. I never published papers or research. I'm very interested in doing residence in Australia. My sibling is already working. Can you bring work into? So as I said, doctor, if you've done, I'll get a job after. See, I can't say this. We can't assure or guarantee anyone that if you've done part 1, you'll be able to get a job. It depends on you, how smartly you're applying, what sort of experience you've got, and I always ask the candidates, if they're disappointed, have you applied? Have you applied at least 5 jobs a day? Once you've applied, once you have a CV, once you've mentioned everything that you've got in your hand, you're doing the right things. If you've not got it, if you're not getting a job interview, we need to fix something else. We need to add more things in it. Definitely, the chances are high. There are so many people getting jobs here now. With the observerships, anything that you do, if it's Masters of Public Health, if you worked in aged care, if you worked anywhere, if you're doing even customer service at the moment, add that in your resume. That makes a lot of difference that you have that Australian exposure with you, and add it in your resume. It will help. Yes, definitely it will help. Help with observership. We do have a observership that we offer to our candidates for free, but it's just 1 day with a surgeon. He's a senior surgeon. He's an examiner as well. And then, yes, there is observership available with him, but it's just a 1 day observership. We don't help with observerships at other places, but if you have your resume in which you mentioned the courses in it, Alan being your referee, you might get more chances to get into observerships, which can lately get in my graduation year. Because see, the CPD hours that you get, it even gives you women health workshop, it gives you ingrown toner, it gives you suturing, it gives you communication workshops as well, and all of that adds on. So you make a big chunk of block where you write Connor's professional development and add everything below that. My graduation year is 2014. I've gone to a specialist surgeon in my country. I would want to start over again in Australia. What are my options? You could, if you are still a surgeon, if someone is a consultant level in their country, they can apply for a specialist pathway, but it's a bit tricky. It costs you about 10 grand to just sit for an interview, but it's not an impossible dream though. Alan says that as well. But yes, why not do your AMC part 1 or apply, and then definitely with this much experience, you can get a job straight away after AMC MCQ. I've moved to Perth, have 3 years of experience in medicine, surgery, and no clinical gap, but unable to secure a job. Okay. Are you applying? Where are you applying? What do you have in your CV? Have you done a bridging course with anyone in Australia? Who are your referees like? Have you fixed all of these things and try to apply everywhere, not only on Seek and Indeed? If yes, please let me know after that, okay? Hello there, I've cleared MC1 this June and I'm currently employed in the residential RMO for a year and I've done 1 clinical internship. How should I proceed further getting a job? So the only way how you can increase your chances of getting a job is start preparing for part 2. If you've done your part 2, if you have it in your hand, no one can stop you from getting into a job as well. Meanwhile, get yourself sorted and apply. Apply. That's the only mantra that you need. Apply for the jobs. Is it possible to get an internship? Right. Yes, we get a lot of doctors. For example, if they've done their degrees from Iran or from Philippines, there were a lot of doctors who graduated in different countries. There was one doctor, she was from India. She did her degree from Philippines. And then now she can't come back to India because to do internship in India, she'll have to clear her exam and stay there for 2 years. I guess there was something complicated like that. We've got her into internship here. Yes, you can. It's very difficult, more difficult than getting a job, but not impossible. A lot of our doctors have got it. Yes, how to get a referee on CV. I'm doing my part 1 in November. Yeah. I've completed my postgrad in anesthesia and this is in 2023. Well, let me set it up. So MC part 1. I want to pursue the career in. Thank you. I'll wait for Alan to answer this, Dr. Sadipta. We do have a lot of doctors with the same situation, but there's a doctor who does our communication and implant workshop. He is a senior anesthetist here, so he can answer all of your questions. I'll ask Alan to answer this as well. Do you do clinical exam? Okay, I'll give you some brief information about what do we do. So from EPIC till you don't, your part 2, we prepare for everything, even general practice. So the general practice pathway, if someone knows or if wants to know about that as well, we can answer that too. If you've got some general practice experience back in your country and you'd like to work as a general practitioner here, if you have 6 to 7 years of experience, it comes equivalent. If you get it assessed, it comes equivalent to 3.5 years. There'll be people who will be saying, we'll give you job offers. It's not that easy. You'll need to assess your experience that you had in your country. If it's 7 years, it comes down to 3.5 or 3. And then the clinic will give you a job offer. Once you've got a job offer, you'll clear your PESCI. That PESCI can be IME, can be ACRM, can be RACGP. Always go with the one which is having a higher pass rate now at the moment, okay? Once you've done that, you do general practice, but you'll need AMC part 1 for that as well. I want to get a non-clinical job as I wait for clinical job. What I need for that? What sort of a non-clinical job are you looking for, doctor? You'll have to apply as well. Any other queries that the doctors might have? No. Yes, we've got 3 more questions here. Do you offer the courses for ABC1 and all? AMC1, yes. Okay. So I'll briefly explain. Again, I'll come back to that. So EPIC number AMC part 1. Yes, we do prepare you for AMC part 1. That's a multiple choice question exam. You've got 150 questions, out of which 120 you need to attempt. And this is what we teach you here for out of 5 choices, how to choose that one choice quickly and pass your part 1. After we've got a very high pass rate for part 1. preparation, and we've got very high pass rate for part 2 as well. Alan has been doing it for 40 years, and I'm here for 8 years as well now. So yes, we prepare you for both part 1 and part 2, and you get all the CPD hours, you get all the CPD points, everything that you need to represent yourself better. If there are 2 people being interviewed, or 10 being interviewed, or 20 being interviewed, someone whose resume would get picked up and would be chosen for a job would be someone who's done a course from us, someone who we've prepared. So yes, we do prepare you for all of this. Yes, we've got courses for preparation of the AMC MCQ Part 1. Yes, you can email it, Dr. Fatima. Definitely you can. When are you starting? And our courses run throughout the year back to back. So if one finishes, the next one starts. 365 days we are running courses, day and night. We start at 9, we finish at 9. Yes, we have courses all the time. We have them. All of them have been, the dates are there on the website. I'll put the dates up there as well. For more information, you can send us an email as well, okay? Send us an email and we'll reply you back any queries that you have if you're reluctant to ask here. So is the content enough to pass, or do we have to have some? See, we do share all the resources with you that you need to pass your clinical and MCQ. There are thousands of slides that we share with you. That's more than important. We make a WhatsApp group here. You're members of that. The whole community comes together and we share all the material that you need to pass. We have a whole venue here as well. If the exam starts on face-to-face back next year, we have the mannequins, you can practice. They all come together. They have study partners, because we teach you a lot, but you need to sit together with someone to study. So, and revise what we've taught you, because it's an intense class 9 to 5. So you have a study partner, stay here longer, come here earlier, and then you can study with each other, go through what we've taught. I'm from India, graduated from China, did internship in Zambia, graduate from China, and came back to India, cleared the foreign medical graduation exam, and did 1 more year of rotatory internship in India. Now I'm planning for AMC MCQ. My plan is to get into specialty program in Australia. How many years after clearing both exams one can go? Alan, there 2 or 3 people have asked me how long it takes to get into training.
Kush, could you ring Dr. Naraj and see what's going on?
I can.
Okay. So with the training, what happens is that you'll start working, and you'll start working with temporary registration. Then only on passing the clinical and working for 12 months will you get full registration. Once you've got full registration, you'll be the same as any other doctor in Australia then. So every year when you're working in the hospital, they'll say, okay, this is the time now. Who wants to be a physician? Who wants to be a surgeon? Who wants to be a pediatrician? Who wants to be a psychiatrist? And then you'll apply to get into the training program. By that stage, you'll have been working in the hospital for more than probably 12 months. And then you'll have some sort of professorial support for your application. You mightn't get in the first year, but you might get in the second year, because these specialist training programs are very competitive as well. So you'll need some sort of consultant, or one of the associate professors or professors to support your application. And then once you get into the training program, which I've got many like this, then you, whatever specialization it is, it can be ophthalmology, dermatology, whatever, you'll be in the training program, and then they'll run everything through. You'll be on a special program where everything will be organized for you. If it's GP, usually there's you'll work as a GP for a while, and then after working for more than 12 months, then they'll say that you're eligible to join one of the PEP programs. And now they have like an MCQ exam to get into the PEP program too, which is pretty easy for the overseas doctors. Once you've sat that exam and you've passed, then you're admitted into the PEP program, and then all of the training is organized for you, and that's when you'll go through your different fellowship program for the GP training as well. Okay. I'm currently a year 5 medical student in Vietnam. I'm new to AMC. Could you please briefly explain? Okay.
Alan, someone even asked me about being an anesthetist. So what is it like and how?
Anaesthetist is the same, but if they're already an anaesthetist, the College of Anaesthetics is here in Melbourne. So what I would do is you send an email to the College of Anaesthetists and outlining what your experience and see what they come back to you and say. I believe that there is like a bridging program for anaesthetists as well. So, but then you would be better to find out that advice off the college. But then it's the same. If you want to be an anaesthetist and you're not already an anaesthetist, the same. When they ask you to apply for specialist training, that's when you would apply to do your anesthesiology. That one was asking me about from Vietnam. They're in year 5. They wanted me to explain about the MCQ. So the MCQ training, look, our pass rate, I don't know whether Kush has already said this, is about at least 95% people who do our course who pass the MCQ exam. Okay, so everything you do in this course, it's not a course that's trying to teach you medicine again. It's a course about everything you do in this course will be preparing you for the MCQ exam and give you the best shot at passing the exam at the first attempt. So all of our tutors are all overseas doctors that have been through that program and now that are working, and they all are aware of what sort of things you need to concentrate on, what sort of things you need to be careful of, what sort of thing, what effort that you need to put in different areas. So it wasn't that long ago where they were sitting in the same seat that you're sitting in. So they understand what you need to be. Medicine's huge. You know that better than me. You can get lost. What we do, we bring you back in. We target you in to give you the best shot possible to pass this MCQ exam. Okay, and in our courses, you'll do a number of trial exams with feedback, and you do mini trial exams with feedback. So, like I said, our pass rate is very, very good. And if you do it, you can't guarantee anything, but you're a long way down the track of getting through this exam. Yes, Kush?
Alan, Dr. Niraj is here. I'll ask Akhil just to change the name. Can you change Dr. Niraj's name?
So Dr. Naraj, he was one of our doctors many years ago. Now he's running a locum service. He employs nearly 200 doctors. It might even be more now in Australia. So he's based in Queensland, but he's got supplies doctors all over Australia. So I think I'll pass over to Dr. Naraj to tell you what his experience is.
Great, thanks, Ellen. Welcome, everyone. It is absolute pleasure, Ellen, to always talk to the future fellow doctors and colleagues. Everyone, I am obviously ex-student of Ellen. That was Ellen back in 2009 or 10, some time ago. Certainly, the best decision of the life, obviously, is to get on the right pathway with the Ellen Roberts guidance and mentorship. This is, guys, the best shot of getting your exams out. As you know, the exams is not about the knowledge. It's all about the trick and how to crack those exams in the format that AMC would like to do. So certainly no question about it. In terms of your, I guess, Ellen, for the MCQs and the clinical exam that you and your team will cover, isn't
Yes,
it?
I'll do that, Dr. Niraj. I've already covered it.
Perfect, great. So look, I think the reason for me coming into you to let you know what are the potential options after you do the exams or even during the exams when you are clearing the clinical exams. So there are certain career pathways that you could decide to work as a doctor in Australia. Number one is you can follow a hospital pathway, or number two, you can follow a non-hospital pathway, which takes you to the general practice setup here in the primary health networks. If you want to do the hospital career pathway, then the best shot for you is to do the part 1 MCQ and then start applying for the jobs in the RMO recruitment campaigns while you are preparing and studying to do the clinical exams. Mind you, your best shot is after doing the clinical exams, That's when they like, and it's easy from the supervision requirements as well for the hospital to arrange the provider number for you and registration with the APRA. But you certainly have a chance to get a job even after the MCQ exams in the hospital environment, but need to keep that in mind that you must be applying basically anywhere and everywhere. If you do keep things in the mind with your limited choices, I want to work in Melbourne or Adelaide or Brisbane, then I must say that you are limiting your chances. Be open to go anywhere for your first job. It's important that you get your first foot into the system, regardless of where it takes you. And even if it is not a paid job, if you are able to secure an observership, which many doctors do able to get secure in the regional and the rural hospitals for 6 weeks, 8 weeks, 12 weeks, 7 to 8 out of 10, while you are in that observership, you will be offered a paid job, and that's your best chance to get and secure your job there. And obviously, once you do your second clinical examination, you will finish your rotations, you get the general registration. That cleans your pathway to go towards any specialty that you would like to progress. Then you will get obviously further guidance in the hospital from your consultants and the registrars there. They will guide you based on your preferences and choices. However, if you do decide to go in a non-hospital environment, it is always better to do that at least up to general registration or 1 year of internship in the hospital environment, even if you do decide to come into general practice. And the reason for that is that gives you a good understanding of how Australian healthcare system works. How does cross reference to any specialties or reference to hospital and pathology, diagnostic imaging, etc. How whole system works. It also gives you a lot of clinical confidence to deal in the situations where you don't have a lot of support out there in the community, especially in regional and rural area. That's why you will be having most of the chances of success of getting a job. So I would highly recommend to spend at least 1 year in the hospital, in especially like emergency, pediatrics, and one of the surgical or medicine branch as per requirement anyway for your general registration. There are certain chances where you could get a job as a GP in a limited registration in an area of need, or what we call now district of priority assessment, DPI, which would be from triple M 2 to 7. Now, these are all technical words which the government use to essentially identify the areas of need where the doctor shortage is there. That's where your best chances of getting a job. More further you go, better chances you are. But just keep that in mind that as far you go, there would be less resources available, there would be less specialist and other things available. So you need to make sure that you are confident to be able to handle those situations in those circumstances. Hence, your hospital work will always help you. After doing MC Part 1, there are limited chances of getting a provider number and a job offer under level 1 supervision. Now, there are different types of supervision, as Kush can explain you later on. Level 1 means one-on-one. That means every patient you have to discuss with your supervisor before you let the patient go. Very stringent and very hard for the practices to be able to make a doctor available for you to be able to give this much of time. It is a lot of cost to the practice or any clinic there. One thing I always put stress on to the new doctors that come in, that any clinic or practice who is looking to offer you the job in the situation where you would need most of their time, effort, and resources, commit to them for at least a reasonable period of time, which means that they should not feel that it was a bad decision or it was not a worth of their time to invest in you. Yes, understand that no one is expected to stay there for forever, but certainly 3 to 4 years is a good time. By the time you clear your exams and become an independent license and the fellow GP, and then you are out and about. If you like the practice, you stay there. If you don't like, you move on. But this much would be a reasonable expectation from your supervisor or your clinic to give back in lieu of what efforts they have put into your career pathway there. Of course, exceptions are always there. your probability of getting a job in a clinic outside in the GP world increases if you does pass the clinical exam as well. Because regardless, even if you don't pass the clinical exam, you have to go through another um, OSCE or clinical case scenario based test, which is PESCI. And again, Kush can again get you more information about the PESCI as the team here at IMGs, they do the PESCI preparation as well, and they are clinical based scenarios. The ideology behind the PESCI test is to test you are ready for the job or not. Are you able to communicate the patient well? Are you able to handle the consultation well? Are you able to um, navigate the conversation in a right path, even though the situation could not be as favorable as you would like? For example, breaking of the bad news and other scenarios as well. So this is the test of you as a doctor and as an individual to be able to function um, independently. That's the whole idea of the pesky test. And the pesky test is a clinic specific test. So if you have done pesky for certain clinic, that is related only with that clinic. You cannot take that pesky results and go to another clinic. You need to go to another set of exams for that, unless both situations are comparable in a similar demographics or similar sort of complexity that you would expect to see in that particular clinic. So once you do the part one, part two, you still have to do the pesky exams if you're not general registration, but your chances of success of getting a job as well as delivering a good clinical services out in the community would be definitely, your chances are much higher in that case. And certainly when you do this way, and further you are again rightly situated for the fellowship exams for the general practice. So these are your couple of pathways to get into the workforce here and achieve the specialist recognition at some point of time. That's what everyone would be aiming for. There are again certain pathways of getting the GP training program, which would depending on individual circumstances, location of the clinic, demographics, your state, etc., etc. But I think important for them for that is first you get your exams right, and once you are ready for this job, just apply. Be ready, prepare yourself, and guys, you need to be make sure that uh, this is a very common problem in the clinics that we face is many of the doctors, obviously we are when we come here we are sometimes overqualified. Somebody could be orthopedic surgeon, ophthalmic surgeon, ENT surgeon in their home country, but if you are coming to the general practice or even in the hospital as a resident doctor, as an intern, you need to understand that you are there as an intern. You need to understand that you are there as a GP. Don't put your specialist hat, but just think as a GP and community doctor, and do and handle the situations that way. Very important to learn all those skills which Arimgaz has to offer about your communication skills, how to handle the consultation, how to, breaking of the bad news, etc. Very, very important. Talking, communication, and using the right words are paramount in the community practice here. And most of you most likely will end up going in the regional areas. And trust me, regional areas in the community, they either like you or they hate you. There is nothing in between. Okay, so you need to make sure you are in the other side of the zone where they like you. And if they like you, your life would be very, very happy. And if they don't like you, then yes, you will not survive much there. Um, don't hesitate to ask for help. Obviously, whenever you need any help, do not hesitate to take a second opinion. Just remember, in Australia, it is a very open and honest community. If you don't know anything, feel free to say to patient, look, I'm not sure about it. I'll come back to you, rather than saying them anything what you think which may or may not be right. Don't make any false promises. Don't give any false expectation. Be truthful and honest in the most and the best possible word framework that you can offer to them. Always take advice, second opinion, ask your seniors, supervisor, look, could I please discuss this with you? Have I missed anything? Should I be doing anything else? Patient will not feel bad. In fact, patient will feel good that you are taking advice and some opinion from someone else. That is a very, very important piece of advice that I could give you. Otherwise, once you are ready for it, take our details from the Kush, and then we will see whoever wants to apply, more than welcome. With us, you can work in most of the states with us. We are in 5 states, so definitely we could be able to help you. But it all depending on how much committed you are, how much you are ready to move in, what's your flexibility is like, etc., etc. But more than happy to help. Happy to take any question, Kush.
Thank you, Dr. Naraj. That's a pleasure to have you always on board. I guess they have a question that's, can we do locum work with limited or provisional registration? This is something Alan can answer without any clinical experience.
I'll be better.
Yeah,
if
look,
Naraj answer that. Yeah.
Locum work, yeah.
yeah, look, I mean, work-wise, it's not impossible. It could be hard, but not impossible to get a work. But what is much harder is, are you ready to deliver the expectation of a clinical consultation? That is very important. Remember, if you take the job on board, it would be expected from you to deliver it. If you have done any mistake, or if you're not confident, if anything comes to your registration or your license, it will be there forever. So I would say, don't go for it unless you are ready. And what makes you ready is your clinical exams or your observation at some other place. Hospital work is definitely highly recommended, I would say. You would understand the system back to front, 100%. But to answer your question, after AMC Part 1, possibility is there with the locum work, but with the level 2 or higher supervision level, not with level 1. Level 1, they don't allow for the locums, level 2 and above. So without doing any work anywhere, you wouldn't be able to get level 1 anymore. This legislation has changed 24 months ago. Before that, they used to allow, but not anymore. Hope this answers your question.
Thank you, Dr. Naraj. Any other questions anyone would like to ask? I think that's all. I'll take down their details. We filter people and then we send it to Dr. Naraj, and he's been helping a lot of our doctors employ them. Yeah, so yes.
No, great. Thanks, Kush.
Thank you,
And
Dr.
thanks.
Naraj.
Always a pleasure to come in and talk. It takes me to flashback to memories 15 years, 18 years ago, obviously, and things haven't been changed. But I feel so good when I see so many enthusiastic doctors trying to get their first foot in the healthcare system here. And
Yeah.
I can promise that I will do my best to get them where they want to be as best as possible.
Thank you, Dr. Naraj. It's a pleasure to have you on board. Alan, you'll have to unmute yourself.
Naraj, I'm going to introduce another doctor you might like to listen to him. He's Dr. Nazarella. For you people that don't know, Dr. Nazarella was from Palestine. There he is there. He's from a number of years ago. Now, rather than me, I just hold him, like I do Dr. Naraj, very high regard. So I'll leave it to Dr. Nazarella to tell you his story.
Thank you very much, Alan, and thank you, Dr. Naraj. It's really very comprehensive. It's very is little to add to what he mentioned, but I will just briefly touch base on the people about my experience and the opportunities here in Australia, and about the people who's really wants to continue and have a specialty training other than the GP here in Australia. Because I'm a general physician and finishing intensive care training here. I didn't go through the pathway of doing GP training. I think first we have to acknowledge that coming to this country is not easy. It's financially and emotionally, it's been very hard and difficult for everyone. So if you feel that you're very under a lot of stress, emotional and physically, that's not only you, that's everyone, and everyone has to go through this. But after you go through this period of passing the exams and having a job and having a good regular income, your life is beautiful. Life is very nice here in Australia. So you will have anything you want to do, your dreams here you can achieve. If you want to do to go to the GP clinic, of course you can go and continue working as a GP. But at the same time, if you want to do specialty training here, there's a lot of chances. Like myself, I did the IMC exams with the help of Alan at his courses, and then I did my first year here. I got general registration, and then I start my physician training. I finish as a general physician, and now and then I started critical care ICU training. I'm finishing that too. Once you start working, you have the working environment is really very good. Here, everyone is supportive. You don't have any discriminations. You have very good conditions comparing to our country's working conditions, good income. You have a stable life. So all what I trying to emphasize here, you have many options here available to you apart from the general practice if you want to do specialty training. Having a bit feeling under pressure, feeling emotional and financially under stress, that's normal, all of us going through this. But at one day in the future, you will be sitting at my position and telling newcomers about your experience and about your success story. So I think it's Dr. Naraj has already explained a lot about how's the system working here. I'll finish it here. If you have any questions, I'm happy to answer them.
Any questions for Dr. Naraj? Dr. Naraj, Dr. Nazarella. So Dr. Nazarella he's achieved a lot here. He's at the Alfred Hospital here in Melbourne, and he's a senior consultant now. So if any of you want to ask particularly about the specialist training program, this is your opportunity. Do it now. Any questions, Kush?
Dr. Nazarella, hi. It's a pleasure to have you on board as well, and pleasure talking to you. So I always get this question a lot. How long can it take? Is it different for everyone? How much time? Because everyone dreams to get into their specialist training, and if they're already at a certain position there, what time duration are we looking at?
I think it's the first obstacle to go through to the exams, the AMC exams, and get general registration. And it depends on different from one specialty to another. Relatively, general physician is easier than, let's say, if you want to do surgical training, it's really very difficult, even for the local, for local graduates who's finished their schools from here. And they find it's very difficult to get into the surgical programs. But let's say if you want to do the training like what I did, is the general physician is less competitive. Emergency care, it's still they want, I know many IMGs who did physician or did emergency training. So once you're on the training program, then you progress. In case of general physician, you do 3 years of basic physician training, and then you do your exams, and then you do advanced training in the subspecialties of your interest. Likewise, in critical care training, you need general registrations, and then 3 years of basic training and 3 years of advanced training. Emergency, I think you do 3 years, and then you do a couple of years more, about maybe 5 years total training. So.
Thank you, Dr. Nazarella. Someone asked that I'm interested in nephrology specialization. So what all specialist training to undergo, sir? Can you?
Yeah, here is different than many overseas training programs where you can go straight to the training program. Here you have all the subspecialty. They have to go through the physician training to do 3 years. After the 3 years basic training, you sit the exams, and then you apply for the fellowship. No further exams. You apply for the subspecialty training, which is 3 years more. So after 3 years, after 6 years on total, you will be a qualified a specialist in nephrologist. But don't when you become a special in the specialty training here, when you're working as a doctor, don't look at the years. This is 5-6 years of training. During these years, you will have a good income. I mean, a good income. No one's, you will have a good income to be able to meet all your family expenses and requirements and have a good quality life. And you don't have, like in our countries, where you do 3 or 4 years of training, you sleep in hospital. Here, you don't do that. You do 40 hours maximum a week, or you do 46 hours every fortnight, and 10 hours of training, paid training and education. So you don't overwork. Even if it's last 6 or 7 years, you still have a good income. You have a good life and work balance. So you can finish your training.
Someone said that I'm interested in critical care. Is it possible to secure a job after AMC Part 2? So as you said already, that.
Yeah, you can. All the critical care training you need to do. You need to go through you do the general registration and then apply to the college. You apply to the college. If you want to do ICU, then you apply to the college. If you want to do anesthetic, then you need more. You need to have more experience before you do that.
Oh, I think that's all I'm with the specialization.
So,
Yeah.
all right. So thanks
Sorry, I
very
might-
much. Yes.
Ellen, I might add this, that you have definitely given me surprise. Nazarella and I did the clinical AIMS exam training from the same batch under you. So, Nazar,
Really?
nice to see you.
And both of you been very
Likewise here. Thank you.
Yeah.
So you Alan, you don't see your people coming through your course. They doing very well, huh? We appreciate your hard work and your guidance.
No, great.
Thank you,
Kush,
Doctor.
if you wouldn't mind sharing details of us both together, that would be great.
Yes,
Yes,
definitely. I don't have Dr. Nasir's details. I'll take it from Alan.
Yeah.
Yeah.
All right.
Okay.
So thank you very much,
Thank
Dr.
you so
Nazarella.
much.
Thank you, Dr. Naraj. That's wonderful.
Thank you, guys.
Thank you.
Thank you for taking out your
Bye.
time, Doctor. We know that it's really precious. You might be on your break, and Dr. Niraj did it from Vancouver. I think it's almost dinner late night. Thank you, Dr. Niraj, for always contributing, and yeah, it's a pleasure to have you all.
No
I
problem.
didn't realize that you and Nazarella are in the same batch. That's wonderful,
Yes,
isn't
we were.
it?
Sure.
No.
Dr. Niraj, I'll send it to you.
Great. Thank you, Ellen, and
you.
thank you, Kush, always. All the best, everyone. We
Thank you.
look forward to see you in the workforce sometime.
All
Yes,
right.
sure, definitely. Thank
Thank
you.
you. Bye.
Thank you.
Bye.
Bye for now.
So everyone, just to finish off, I don't know if they've got any more questions, but the
Yes,
other thing
they've
I want,
got Ellen. So
why do you want to ask me first?
yeah, so she was saying that there was one Tika. She said that is it difficult to get into OBGYN or is it easy? Can I say something on this, please?
Yeah, sure. Of course.
We had almost I think there were 14 doctors who were placed in Very Be Mercy. So many people going into OBGYN. If you have a good experience back in your country, please apply. Even there is one example. I don't know that went wrong or what happened. She's been interviewed before Part 1. This is the first time I've seen that. And she had experience in OBGYN, but she had our course. So we've done her reference check, but they'll wait for her to complete the Part 1. So OBGYN is good. Yes. I'm interested in critical care, I've answered. I may have missed, but please highlight the specialist pathway for the overseas consultant with at least 2 years of experience, postgraduate experience, and also share the contact details. What are the timelines and pathways for radiology? Is there any benefit if someone has completed PLAB 1, but not PLAB 2? Is it possible to get a job if we complete both Part 1 and Part 2 immediately after internship? Yes, yes, yes. In our country without any further, yes. With Part 2, yes, definitely. How about ophthalmology surgeon? How difficult is it?
Well, ophthalmology is the same as any other specialties that Dr. Nazarella talked about. I mean, I've got a couple of people who've gone into, my ophthalmologist is one of my ex-students. So he got into medicine, got into, he did his got full registration. Then he applied to get into the ophthalmology training program. And now after 5 or 6 years, he's an ophthalmology consultant. He's in fact my ophthalmologist, and he's also an examiner at the College of Ophthalmology too. So I think the pathway, like Dr. Nazarella said, is pretty much the same for all the specialities. You need to get in there, get full registration, get some experience behind you, and then apply to get into those pathways. And some of them are more competitive than others. And ophthalmology will be a very competitive one, I can tell you that. The ones where the income is higher, they're the most competitive. And ophthalmology is one of those.
I am MD, MS, PhD working in pharmaceutical company for research 5 years now. I've passed AMC Part 1 OET previously, could not attempt AMC Part 2 due to visa issues, now failed the online exam, now trying again. I'm almost 38 years now, living out of Australia. Is this age difficult? And working in pharmaceutical is a clinical gap. Do you have services for applying on behalf of applicants, especially those busy and unfamiliar with Australian healthcare system?
So 5 years is not a drama. I wish I was 38. So the 38 is young. So don't worry. And then and 5 years, because there are no exams for 2 years. So that's about a 3-year gap. And the fact that you've been working as a pharmaceutical rep, that would also be good in your CV as well. So don't worry, you need to get back into it. Either if you can afford it, you're working, come and join the course. You'll realize why you didn't pass. And now, for all of those that don't know, now you need to pass 9 stations, not 10. So you'll sit 16 stations, and 2 of them are research questions. So you're 14 and you need to pass 9.
Yes, and with all of those who are asking me about the courses are face-to-face, online, is the material available or not? See, the pass rate is very high. It's more than 95%, as we said, and
Or the MCQ, not that high for the clinical.
Yeah, but so we have all the courses online as well, face-to-face as well. It's a combination as well. We have the whole venue available here at 3 Bowen Crescent, level 5 in the city. We are always open 9 to 5 here, 7 days a week. Alan is here 5 days. And then is it better to do the AMC clinical in person, or should I take it online? If you are not in Melbourne, you can do it online, and it's the quality is going to be maintained in the same way. You'll get same sort of opportunities to do role plays. The way how we teach you is we teach theory as well. We teach you examples as well. We teach you through the notes as well. We prepare you for whatever comes in the exam so that you can answer it.
And we'll create a portal when you join the course. Yeah. And the tutor slides will be uploaded in the portal after the tutor happens. So you'll have access to those slides until you pass the exam. So you have access to all of the material. And then I encourage people to help each other, to share material. And I give you advice about which is the best way to look at for what sort of material you need to help you prepare this exam. But for those that don't know, I told you the AMC is opening up their new exam centre in Melbourne from February next year. So the majority of the exams are going to be face-to-face again. So the online ones are full for this year. They're going to release, so all the only people that can get an online exam are already on the wait list with the AMC. And then, so the majority of the exams that you'll be offered next year will be face-to-face exams, which means you'll have to come to Melbourne to sit at the exam centre to sit. I'm sure there will be some online exams still, but they're switching to most of them being face-to-face again.
But the preparation has all the content. The teachers will teach you in a way that they have already passed AMC and they're experienced enough. They've been teaching face-to-face when it was face-to-face and online too. Doesn't matter if you're in Tassie, we have people from Iran, Iraq, India, Sri Lanka, Japan, China, all across the world attending the courses online and passing.
You can see Dr. Naraj just came in from Canada.
Yeah, and
how clear it was.
last Thursday, there was a result, and we've got people passing from China, we've got people passing from India, we've got people passing from Iran, we've got people passing from Sri Lanka, everywhere. So the quality is something that we maintain. And then if it doesn't matter if you're doing it online or face to face, for us, it's always word to mouth. If you're not happy, we're always there to assess our courses day by day, every day, and to retain that quality. You'll get access to the course notes. Yes, you will. Definitely, you will get access to the classes, course notes, slides, role plays every day.
Until you pass the exam, then we
Yeah.
take you off.
Yeah. So the way how we teach you clinical, because there are a lot of questions they're asking, just like the real exam, 2 minutes of STEM reading being given, then there are notes all across everywhere online, so much of content available, but you won't get this. For example, I'll sit next to Alan, and if it's a student, we'll display a STEM and you'll be asked to read and perform, and then you'll be commented on each and every history taking, how to take history, what should be the structure, how should be the differential diagnosis, do you need so many differential, did you need this long history, was there mention that it should be 6-minute history taking, what does it exactly take to pass this exam? So we do trial exams. You sit through 16 stations like your real exam. Every day there are role plays, and then you come and introduce yourself, opening of a case, winding up of a case, finishing it between 7.5 minutes, doing OBGYN, psychiatry, physical examination, all different sorts of cases in one go in 16 cases. So all of that is done. Detailed feedback is given every day, is improvement. That's why we maintain that sort of high pass rate. And the GP pathway, there was someone asking, Alan, I would like to know, who do I recommend? We put in the referees ideally. Do they have to be current supervisors? I work in a GP practice in United Arab Emirates from 3 years and have 1.5 years of hospital experience in my home country. Can I keep previous seniors as referee?
Yeah, so yes, you can, but you'll need some referees from Australia. Okay, if you want to work here, ideally, it's better to have some referees from here as well. Okay?
Can I add to this?
And that's one of the benefits of doing the course, that I can be referee for you. And I probably do 2 or 3 referee reports every day.
Yeah. And then they add his details down there. So what happens is, straight away they know it's Australian number. They can contact this number straight away rather than putting postal codes, different time zones. They call us and they do a reference check, or they send a report, which Alan does straight away, or he asks the team, how was the person? Did they perform well? There are questions like, our students, when they pass, they start teaching as well, or they become clinical examiners as well with us, which is an important thing that every interviewer would ask. When they do a reference check, they ask, did this person teach? They really want, it's a very good plus point in employment. They would prefer someone who can teach their juniors. So this is something that's countable. A lot of our tutors get employed straight away. So yes, you'll need Australian referees, or wherever you want to do the courses. It's good if you start teaching.
Doctors, I'll show it to you now. This doctor sent me this. He said, Alan, this was one of my students many years ago now. When he came to my course, he didn't have his internship. This is him now, and it was on the Channel 7, and he sent it to me. And he's now a cardiologist, and this was the news item.
An Australian first operation has just taken place in Melbourne, and it's set to make life much better for patients with heart problems. 7 News was granted exclusive access to the delicate procedure.
A lifeline with a difference. This is the next generation of
That's my
devices.
student that came
It's a
to
new
Australia with
way
no
of thinking
internship.
about treating these heart rhythm disturbances.
Defibrillators shock the heart once it goes into cardiac arrest. Some models can send electronic pulses that painlessly short-circuit a cardiac arrest before it happens. To do that, the heart has needed wires inserted inside it. Until now, leads in this new model sit underneath the breastbone, outside the heart.
It's smaller there's a lower risk of complications from wires inside the heart.
Ghulam Jalani is just the second patient in Australia to have one inserted. He's got new peace of mind.
When there's no risk of, any complications from them, yeah, you feel great.
7 News was given exclusive access to his operation today. St Vincent's private heart specialist, Wes Mohammed, is the only doctor in Australia trained for the procedure. This new device also lasts longer. Batteries in previous versions have typically run for up to 8 years. This defibrillator will have power for more than a decade.
If something were to happen, then they've got a little ambulance in there that's gonna save them.
Valuable for those with heart problems. Rory Campbell, 7 News.
There you go. That was one of my students not that long ago. And he's the only doctor in Australia doing that procedure.
Any advices you'd like to give them? I think we're about on the time to wind it all up. So for preparation of part 1 and part 2, Alan, any tips and tricks that you'd like to give them just to wind it up?
Only I think, everyone will feel a bit unsure whether they should go ahead or should do the exam, or even when you do the course, you still feel unsure whether you should sit the exam or not. In life, we've got to just take those chances and we've got to go for it. Okay? So my advice is to throw yourself into it. And then before long, for sure, you'll be in the system. Okay? Even when you're looking for a job, you've got to be, very proactive. Okay? If the days where the hospitals will come chasing you is gone, you need to chase them. And you need to be very proactive, and then for sure, seems a long way off, but for sure it'll happen, I promise you. You put the work in and it'll happen for you.
Thank you, Alan. So I've added on our email address there. That's our admin email. So feel free to send us any email in regards. So if you've been a bit hesitant to send or ask any questions here, we'll be more than happy to help you. We'll be more than happy to guide you for anything. So we do have small, shorter crash courses as well. That's just 7 days or 14 days after this courses as well, which help you with clinical preparation and MCQs as well. So we have all sorts of options available, some private tutors, free trial classes, always there for MCQs and clinicals. Go and check the website, keep yourself up to date. We add a lot of things on Instagram as well. Follow us on Instagram for more information. We have a lot of discounts at times as well. So to know more about those discounts or any offers that we have, so you can always contact us on Instagram or Facebook or send us an email. If you follow there, you'll get a lot of more offers and things like that. So we always update ourselves with that. Send us an email. Don't be reluctant if it's in regards to any financial issues as well. We can sort all of those things out as well for you. So thank you, everyone.
We can give you advice about observerships.
Yeah.
Observerships are like getting a job now. So, we know which places are doing observerships, so we can help you with that as well.
Yeah.
Okay. All right.
All the clinical trial classes are advertised on the website, doctor. So next clinical trial class is just tomorrow. So we'll be sending you all a link. You can attend one of our most popular tutors clinical trial class tomorrow. So we have trial classes every month, which you can attend. We have Dr. Gaia, that's our senior surgeon, him as well. Then we have our own things that we share with our candidates. So yes, feel free to follow us on Instagram to be up to date with any information or any other, options or things that we are offering. Thank you, everyone. And you can send us an email.
Thank you, everyone.
Thank you.
Bye.
Bye.